Market. Das Special bietet einen Überblick zum US-Markt für digitale Gesundheitslösungen sowie zum Zugang und Vertrieb. Mein Name ist Joanna Zegatlo und ich bin bei Germany Trade and Invest für die Gesundheitswirtschaft zuständig. Unser Experte heute für den digitalen Gesundheitsmarkt in den USA ist Herr Deepak Sahu von Alira Health. Herr Sahu berät Medizintechnik und Pharmaunternehmen beim Markteintritt in die USA. Umfassenden Hintergrund in der Entwicklung von Gesundheitslösungen und verbrachte mehr als 5 Jahre in Strategie- und Projektmanagementpositionen in Europa, Japan und den USA, bevor er zu Alira Health ging. Herr Sahu hat sich heute für uns von der Ostküste der USA eingewählt und wird seine Präsentation auch auf Englisch halten. Hello, Deepak. Thank you for joining us today. So yeah, the stage is yours.
Thank you, Shona, for giving us this opportunity, and welcome everyone to our presentation today. In our presentation, what we will be looking at is how digital health and reimbursement happens in terms of the US market context. When we discuss about digital health, the first important parameter that we need to consider is how the market is segmented. And that brings us to our current slide. As you can see on the screen, these are two different bubbles of where the digital health lies. One is on digital therapeutics, that is on the on the bubble in and on the digital health. The clear distinction between digital therapeutics and digital health. Before you embark on your journey into the US market, you need to understand where do you actually fall. Because if you are a digital therapeutics, you need your clinical evidence and you need your real world evidence, and you get classified into the medical devices domain of software as a medical device from FDA. So understanding where you have the right to play and right to win is critical part of it. And I'll always refer you to refer to this bubble and see where you are, which bucket you are falling into. Moving on, this is a slide that talks about a lot of different solutions that are available currently in the market, and where do you what are the needs from the market when it comes to particular of those product lines. If you see on the left hand side, you have the MD cleared, which is medical device cleared, whether you need a supporting study, whether there is reimbursement for it, and when there is green it's available, yellow is optional and not available. On the y-axis, where you see is where does it fall in the management or the involvement with the patient. So one on a passive management of a particular disease to another on the active management to a particular disease. As you see in this graph, as you move from the lower left corner to lower higher right corner, your probability of getting reimbursed increases definitely, but at the same time your burden to have clinical information and to be FDA approved increased. We have put together here certain example of the companies for your reference. So whenever you are also deciding on a particular digital health parameter to follow, not only keep the circle that we discussed in the previous slide into notice, you should also keep where can you be a comparable product, where do you actually want to go. Again, taking a step back, there is not a market successful or unsuccessful that is determined. There are players who are involved in passive engagement over here, like Spry Health, Sonasure, are quite successful as a company. And there are companies out here as Propeller and Capmedic. They are also really successful. What you need to be clear in your mind is what you need to bring it into the market and have the expectations of yours, your investors, your stakeholders, actually aligned in the same pathway. Moving on to the next slide. Uh, in this slide, you will get a lot of information about how FDA approaches medical devices as digital health. You are all aware that is FDA is currently regulating software as a medical device. There are clear guidelines, and I'm not gonna go through each one of them over here. But what I'm going to bring to your notice is the more you move on the x-axis, as we saw in the last one, the more you move towards getting cleared by FDA, the more you move towards falling into this realm rather than a class 1 medical device. So positioning yourself in the previous slide is critical for understanding where do you actually cross into the FDA pathway. There are couple of new codes that has come into the play which will be beneficial for you to understand from a reimbursement perspective, and we will touch about reimbursement later. But when we talk about digital health, these are the set of 5 different codes that are required for you to get analyzed. Now, the critical part over here is the first 4 codes are always applied in tandem, so they are applied together. When you dig deeper into the code, there is an amount of money that is being allocated for your device supply and daily recordings, which is around $64 on a Medicare average pricing. So for your technology within the reimbursement, there is some amount of payment possible. Okay, so what I'm trying to say is the digital health, after the introduction of this course in 2019 and after coming of the COVID situation and the pandemic situation we are in, there is availability of the reimbursement, but you need to plan your product development accordingly so that you are being affordable in that particular range. I would encourage if every of the players over here, when these slides are available to you, to please go through the course and see how you fit into this particular domain. Apart from the code, there are some examples of partnerships of digital therapeutics with providers and payers, not digital health, so digital therapeutics. When you look at, for example, Livango in case of diabetes management, their partnership with Anthem. So you will also need to keep in mind that many of these digital therapeutics have a possibility of um, partnerships with payers. Now, we will switch onto the reimbursement part of it, and I want for every digital health company to be aware about this. When you talk about reimbursement in the US, there are 3 pillars: coding, coverage, payment. If any of this component is missing, you are not going to get paid for, because the coding determines coverage, the coverage does not determine payment. These are 3 different aspects you need to take care of. When we talk about coding, there are a lot of different coding opportunities that you see over here. When it is DRGs, APCs, CPTs out here, the most important bucket where you fall in as a digital health is common procedural code, which is CPT coding part of it. And we looked at this codes in our previous slide. There is existence of code for the digital health. For digital therapeutics, you can go for higher codings because you are bringing more value to the patients. So apart from those 6 codes, you can say, okay, if I'm doing a digital therapeutics for diagnosis of cardiac arrhythmias, so you can at least go for a higher code, but at least you have some code to start with. When we talk about coverage, this is an interesting chart that we need to look at. If you look at this, you have on here age, and if you have over here the income level. The way the entire US is divided is above 65, you have Medicare coverage. Below 65, if you have an income level of 133% over federal poverty level, you have Medicaid, which is state level. So if every state has a different state level Medicaid, whereas Medicare is central, is a federal level, is a federal program. If you are above a certain federal poverty level, there are commercial payers who cover you. As you can realize from this graph that the payer market is quite fragmented. So a lot of coverage decision happens with the largest payer, which are the Medicare. So how does it happen? The Medicare takes a national coverage determinant and local coverage determinant, which kind of start precipitating towards Medicaid and commercial payers. Depending on their evaluation, they will start covering that particular technology. Give you an example. There is a code for I'm giving this from an example of MRI and ultrasound fusion prostate biopsy. There is a code for ultrasound, there is a code for MRI, but there is also a code for combining both of them for prostate cancer diagnosis. However, you do not have a coverage determinant for them. That means the payer have not determined that that particular fusion software that is being used to merge both of them is medically necessary for their population. So even if they have codes, they will not get paid for because there is no coverage for it. Hmm. So you need to determine what they need to do. They need to go reach out to Medicare. They need to reach out to commercial payers and tell to them that they are actually adding clinical value so that in their policy documents they can include it as a coverage determinant. Hmm. So this is a clear example of a fusion software which falls into digital therapeutics, which has a coding but do not have coverage. That's why they will not get paid for. So when you are into that domain, realize what reimbursement strategy means for you. Now, those local coverage determinants that we spoke about in Medicare have 16 different components and are at different 16 different levels. And this is how, from a geographical perspective, they have been divided. They are called as Medicare administrative contractors, and in those Medicare administrative contractors, they are the people who take at a local level certain discussions. Again, when we talk about, I'll take the same example of the fusion software of MRI and ultrasound that is being covered in and around California because this particular MAC has determined that this is good for them. If we determine over here in H, it is not being covered. So this particular population will not have access to it. Moving on to the payment part. In the payment part, you need to see where that particular digital health is applied. You have hospital, ambulatory center, physician offices. Even the same CPT code has different level of payment based on where the care has been delivered. So if you are willing to go for, let's say, I'm going to go for a code that is mostly being used in the physician office, so your level of reimbursement will be lower because there is a non-facility rate. There is no facility rate attached to it. But if your digital therapeutics or digital health is being used at the hospital and the ambulatory care center and used for patient benefit, not for the structure of the hospital, not a revenue management system. I'm just talking from a patient perspective, right? If it is within those hospital systems, you have access to an additional component of payment that is called facility rate. And if you have that access to that payment, you will start having higher reimbursement. So when you are designing your digital therapeutics or digital health, you need to decide not only on where do you fall. So I have to go back to our slide. I'm just helping you out understand the decision making process, right? This is how the digital health looks like, right? So if you are over here, you are in a low risk domain, but you have a low reimbursement out here. If you are here, you are into the higher risk and patient engagement, like active management domain, and you have access to higher reimbursement. Suppose you decide you are in this domain right now. You have to think about, okay, I'm going to get reimbursed. Where is my probability of getting highly reimbursed, right? And you design your product accordingly for a patient's benefit perspective. And then you go back and you say, okay, where is my coverage, where is my coverage, where is my code, and which facility I'm gonna get applied for. Again, I'll take an example of Fusion software. The Fusion software have a coverage in California domain, we know. But what happened is they start promoting that software more towards urology offices. Now, urology offices are sometimes associated with hospitals and sometimes independent. When it is independent, they found out that they fall into the CPT, into the physician office domain, and they do not have enough reimbursement. Whereas the proper strategy for that company could have been to focus on ambulatory surgical center where most of the patients go for their biopsies, and at that point they have a facility payment attached to it, and they can allocate 10% or 20% of their facility payment for that particular software. So it's critical for you to understand where do you fall in that chart and where your digital health will be used from a service perspective. Now, I move on. This is how the IDNs are structured, and I'm not going to go through all these slides because this will be available to you. What I want to go through is for you to decide on your pricing. When you are pricing your digital health, you need to understand this particular curve. Where do you actually fall in? Where the x-axis represents the outcomes, your influence on the outcomes of the patient, and the right axis, the y-axis, talks about customer purchasing consolidation. So if you are a specialized digital health app, let's say a imaging analysis device, go into an imaging analysis device, you will fall into the lower half, and you will know how who if you are a scheduling software, right, you will fall into the commodity of it. This will actually determine in which direction you are going to push and who is going to be your buyer in this curve. One thing that I want to discuss with you, and this is our last point of discussion over here, is you are an European innovation, and many a times people think that how do I efficiently and effectively use my experience in Europe in coming into the US market. Mm. What you will find on the top is the inefficient strategies that we, with our endless numerous amount of projects with European clients, have come across. It may not that you fall into the same category, but you can take it as for an industry. You have some product development happening over here, then you go and do a clinical pilot, and you have your CE mark on a regulatory over here somewhere. Uh, the clinical pilot can be population based, a clinical strategy, whatever. Then you all of a sudden start thinking about FDA strategy as your first one. Then you pursue the regulatory strategy. Then you delay your clinical execution, and then you do, okay, let me submit a 510K right now. After that, you start thinking about market access. After that, you start thinking about where do I fit in? Who is gonna pay for me? Who is not gonna pay for me? Then what will happen is over here you will realize for the payers and everyone to pay for your device, you need additional real world evidence. So you go and start doing another clinical trial, and you will name it as an evidence generation study or a marketing study. According to us, this is a inefficient way of doing this. The efficient way of doing this is, think about you are in a product development over here and you are planning a pilot in the Europe even before your CE mark, right? Do a pre-submission meeting with FDA, definitely. And in that indication, think about your market access plan. I'm not asking you to invest uh, millions of dollars in market access plan over here. What we learned in our session today, realize where do you place yourself in those graphs, where do you place yourself in the reimbursement angle, who will be your purchaser. Those are the three questions that you need to ask, And that will also determine your indication. You do not want to have an indication in the market and go to FDA that will not give you a commercial footprint. So it's a very minimal exercise that you do need to do in the proactively to inform your clinical execution. Suppose you have to do a trial for your regulatory purposes. You can use your secondary endpoints to satisfy market access needs. You do not have to wait till the last instance to do it, because for a medical device, many a times the inefficient strategy gets successful. What happens with the digital health is your idea is very difficult nowadays over and over a period of time to protect. And that once the idea is out into the market, there will be a lot of different players who understand this market well and will like to compete with you. And that's why I've seen a lot of innovation successful in Germany, France, Barcelona, never made to this side of the Atlantic. So we need to start exploring efficiencies in digital health product development for our success. And with that, thank you, team.
Yeah, thank you, Deepak, for explaining how German companies can introduce their health solutions in the US. Bevor wir uns verabschieden, möchte ich noch kurz die Exportinitiative Gesundheitswirtschaft vorstellen. Und zwar stellt die Exportinitiative Informationen zu wichtigen Exportmärkten zur Verfügung. Diese finden Sie beispielsweise auf der Website oder in Newslettern zu verschiedenen Themen oder Ländern. Die Vermarktung der deutschen Gesundheitswirtschaft im Ausland, zum Beispiel bei eigenen Veranstaltungen oder Messeauftritten, gehört ebenfalls zu den Aufgaben der Initiative. Gleichzeitig erhalten Unternehmen der Branche auch eine Plattform, um sich mit ausländischen Netzen und im Dialog mit politischen Entscheidungsträgern im Ausland werden wichtige Themen für sie platziert. Die Exportinitiative ist Teil von Germany Trade and Invest, der Außenwirtschaftsagentur der Bundesregierung, die von 50 Standorten über so gut wie alle Märkte weltweit berichtet. Damit wären wir am Ende unseres Specials angekommen. Sollten Sie noch Fragen haben, können Sie sich jederzeit gerne an uns wenden.